So once again, it's moving through a cancer diagnosis 101. So these are really a lot of information at a more of a basic level of all the what you need to know, and you'll be able to take some things away from it and maybe not other things, but it's hopefully going to give you the foundation of what to do in many different scenarios. So we're going to look at the treatment plan. We're looking at mental health for both patients and caregivers, and also facing the diagnosis and relationships, and how do you talk to people and discuss your diagnosis, share the information, keeping people informed. So educated decisions. So these are a lot of these statements that we're making really came from the World Pancreatic Cancer Coalition, and really has become a standard in pancreatic cancer in terms of treatment options and from the diagnosis. So we know now, and a lot's changed since, we personally went through this journey almost 17 years ago, unbelievable, is that we need to, oh, Lori, do you have a question before I go on? Yeah, so among all the medical oncologists and the surgeons, really everyone should be getting a biopsy. There'll always be some exceptions to every statement, Lori, but I remember one of the medical oncologists has always said tissue is the issue. So we've had, I can count several patients that we've met throughout the years that didn't have that biopsy, and they actually had a neuroendocrine tumor instead of the adenocarcinoma. So two completely different tumors, but they were treated wrong because they didn't have that biopsy. So a biopsy, and especially nowadays with precision medicine, where patients are being treated individually now based on their DNA and their genetic makeup, you really need to have that biopsy. Not only do you need a biopsy to discover what kind of tumor you have and the staging, but you need it for clinical trials, you need it for precision medicine. So you don't just need it for the diagnosis of the type of tumor you have, but you need it to access a lot of other treatment options that are available. So I'll just get through this slide and then I'll go answer all the questions.
Okay.
Yeah, no, it's okay. Like I have the hand up, so I'm going to stop after every slide. So, when you're being treated, you need to know what type of cancer you have. So consider pancreatic cancer the family name, but you need to know the individuals within that family name. And also its staging, because the cancer you have, the tumor makeup that you have, and the staging is really important to know in terms of the treatment options that you have available, clinical trials that you have available, and once again, that precision medicine. Really everybody, the HPP surgeons are really asking that everyone have an experienced HPP surgeon see the patients to determine whether or not the tumor is resectable, and then to be referred to a medical oncologist. Right now in both the United States and Canada, I'm not sure of the statistics anywhere else in the world, but we do know in Canada and the United States that only about, if you averaged out all the numbers of the different states and the different provinces, we have about 50% of the patients receiving treatment currently. So we have about half the population that hasn't been referred to a medical oncologist, whether it's for management of symptoms or palliation or treatment before surgery or treatment after surgery. There's a variety of different treatment options available. So every patient diagnosed really should see an HPP surgeon and a medical oncologist. And those are statements from the Global Coalition. Asking your physician about all the treatment options that are available to you based on your cancer, your stage, and your wellness. So quite often we're seeing in a lot of the translational data that patients aren't always informed of all the treatment options available. We do know we've seen statistics as high as 60% of the patients that were surgical weren't offered surgery. So many patients aren't always aware of all their treatment options. So you have to very clearly advocate that you would like to know your tumor type, the stage, and all the treatment options that are available to you so that you can make an educated decision and so that nobody else is making that decision for you. Research credible educational websites. So, we certainly have a great resources available under our website on the Learn and resources. Those have been built solely on credible research that the Global Coalition's using that's been seen around the world. You'll be getting a lot of advice on this pancreatic cancer journey about other treatment options, and you really have to make sure that you're really seeing pancreatic cancer specialists and that your advice and the resources that you're collecting have substantial research and data supporting it. You can always seek a second opinion. I know that many patients and caregivers feel scared that they may offend a physician if they ask for a second opinion. In the past, it's always been recommended. The second opinions aren't because you don't trust that first opinion, but it's that second opinion may give you different treatment options than the first opinion. So it's really looking at second opinions are to make sure that you have a clinician that you feel comfortable with and that you can work with. But the second opinion also is to see if there's different treatment options being offered to you or different clinical trials being offered to you. And also clinical trials. Clinical trials 17 years ago were looked at as a last resort. And really for any cancer, for any type of cancer, really the rule of thumb now is that you need to look at clinical trials first. So the majority of the clinical trials will always offer you standard of care plus. So if you're in a clinical trial, we do know through research that patients have a better quality of life, a longevity of life, and they feel supported. Once you get into a clinical trial, if that's the route you choose, you usually are meeting, whether it's virtually or in person, every couple of weeks with that clinical trials team. So you would have a nurse navigator dedicated to you, the patient, and also to that and to the patient's family, that's their caregivers. So clinical trials not only offer you different treatment options along with the standard of care, but they also offer you, support in the terms of being closely monitored. So once again, it's, that certainly is one of the biggest things I've seen change in the world of pancreatic cancer over the last 17 years is clinical trials was seen as a last resort, and it's now a first resort. This slide deck will go out to everybody after, and you can see that there's live links here. So we also have videos, edited versions of our support for caregivers on clinical trials. So any of this information I talk about today, all these links will link you to specialists in these fields of work. So our clinical trials version talks about a lot of the myths about about trials with pancreatic cancer as well. So it's a great video to view. It was created by PanCan for us with Cassidy, where they have, supported research from, all over the United States, but very knowledgeable about the clinical trials. Lori, you had your hand up. Okay, so the biopsy question is, we say, we like to say that everyone should have a biopsy. There'll be certain cases where they won't. If the patient's surgical, they usually do the biopsy within the surgery. So they won't do a biopsy and then go in and do a surgery. They'll usually do the Whipple first, and in that Whipple, they'll take the biopsy. And that's where you can use that biopsy to send for precision medicine, clinical trials, and whatnot. In terms of a referral, you never have to get the referral from the first specialist that you saw. So if you had a surgeon or a medical oncologist and you wanted a second referral, you can go back to your general practitioner. And if your general practitioner won't give you a referral, that's your right. So you do have a right to fight for that. And if that means going in and finding another doctor or going into a walk-in clinic, but patients have the right to say, actually, a second opinion is my right. Any patient can see any number of, you can't be stopped from going to see a physician. So, and your general practitioner would know that. You know,
Okay.
if you, I haven't heard, you know, usually the general practitioners are, you know, have known the family for quite some time and they'll advocate, but you don't need that second opinion from a medical oncologist. And then your last question, that's different everywhere. You know, here in Nova Scotia, the time frame can be anywhere between 2 to 3 weeks before they see the surgeons. The surgeons try a quick turnaround, and then the medical oncologists all try to keep within that time frame. But we do know that that's just not right. That's the time frame you would be looking at, but we know that that's just not possible. COVID has made things extremely difficult. So we're seeing a lot of late stage diagnoses with patients right now, and the physicians are also seeing that. So, you know, a lot of patients we know will advocate it when the referral goes in. They call every morning and ask if there's any cancellations, or they ask to get put on a cancellation list, and they, you know, do a weekly check-in on top of that, but just really riding those referrals and making sure that they stay on top of it and don't let themselves get forgotten. That I think that we're, you know, when you're diagnosed with pancreatic cancer, you should see a 2-week turnaround with a HPB surgeon and then another 2 weeks within a medical oncologist would be the optimal. Okay. Ask them, you know, and you can, and it's, you know, and you have to take in consideration that in the hospital that you're at. So there's always that rule of thumb of going to a high volume hospital. You need to know, you need to make sure that your surgeon has experience. You know, you can ask them how many surgeries they've performed. When my father was diagnosed, I went through the same list 17 years ago, so a lot of it hasn't changed. And we knew that we had a surgeon that had done numerous surgeries, you know, over 100, I believe he had done at that point. He hadn't had anyone go to the ICU or even had gone straight down to step down. So had a high success rate. And you also want to look at the team of surgeons that they have going in with the HPB surgeon. You know, that you want to make sure that they're also experienced. We had, you know, we knew of a hospital where they had an HPB surgeon, one, but then they didn't have the surgical team expertise going in with that HPB surgeon. So that makes a difference as well. And you do not want a general surgeon performing the surgeries, which we know that some general surgeons do. So it's making sure that you ask for their experience, you can ask for their training, you can find their CVCs online, you can look at their research online, so you can Google their name. Everyone's getting great with Google and Dr. Google. You can Google that surgeon's name and know right away, you know, what research that they've been involved in. So if only the research they've been involved in is ovarian or breast, you know, and not GI cancers, you may want to, you know, continue your search. Yeah, absolutely. Is there any other questions for anyone before I move on? Okay, don't be afraid to put up your hand or jump in there. Advocating for yourself and as a patient, you know, I remember when Dad was diagnosed, one of the biggest pieces of advice I got was from another surgeon in Ontario, actually. And he said, you know, if you can't talk to your surgeon, you can ask questions. They don't know about clinical trials. They don't have time for you. Run. And I remember it being some of the best advice I got. So take an active role in your diagnosis, in your own personal diagnosis or your loved one's diagnosis, and understand your diagnosis or your loved one's diagnosis. So read, and if the reading's too difficult for you, there's a lot of video resources. We have a huge library that talks about every aspect of pancreatic cancer, and sometimes it's too hard to read and take in the information because you're really living in a heightened state of stress after a diagnosis. So for many people, including myself, watching videos is easier to take in the information. But really, education is so empowering. The education will reduce a lot of your anxiety and stress because now you understand the diagnosis. And it also empowers you because you know what to ask for. The worst feeling for many people that we've talked to is just not understanding the diagnosis, not understanding the treatment options that are available. What do you do now? Where do you turn? So really, and if you are at a heightened state of stress, ask somebody else to do that research for you. I remember a couple of friends that have gone through a cancer diagnosis that was very serious. It was just, they just handed it over to me and they said, you have to do the reading and you have to tell us what to do. So if you have that trusted friend, that trusted loved one that can do that research for you, um, ask for help. Never, people who love somebody never will be put off by you asking for their help. In fact, if you are the one diagnosed and you ask for their help, you'll actually be doing them a favor. You'll be helping them feel useful to you. So if you're diagnosed and you're scared to ask for help, ask those loved ones for help because you're helping them feel like they're doing something for you. Consider all the risks and benefits to the treatment options that are available for you. Never let somebody else make those decisions for you and your loved ones. You know what's best. So if you have that education and the knowledge about your diagnosis and about your treatment options, know that you will be the best person to make the decisions for your treatment. Which is the next point. Choose what's best for you.
Has her hand up, and she just made a great point in the chat.
Oh, yes.
Jump in.
Absolutely. And you actually just hit on a lot of those ending points, Gabby, is that, you can have a middleman. You have to be comfortable with your healthcare team. You need to make sure that everyone is creating the best treatment plan for you based on what you're comfortable with and what you want. And as Gabby says, don't be scared to ask questions and go back and ask questions. We have an Ask a Doctor program. If you walk out of that office and you're thinking, darn it, I needed to ask this question, use the Ask a Doctor program, and we can usually have the questions answered within 24 hours. Like Gabby said, record it or you keep a journal. Our journal, we still have it, that we kept for my father, saved us a lot of headaches and a lot of stress because we had a couple of situations where we had so many medical doctors with their hands on dad's case that they were getting confused or doing things that another physician had suggested not to do. So we were able to turn back to that journal and say, so and so said not to do this. So and said this was the medication that we needed to use. This is when we had the last CT. This is when we had an ultrasound. This is when we had the blood work. These are the results. So you always had that at your fingertip when the physician was or the clinician was talking to you. And take care of you. You'll never be judged whether you're the caregiver or patient in this situation for taking care of you first. So it's, a lot of people use that analogy of, the air masks going down on, when a plane is experiencing bad turbulence. Put that mask on you first and then look after your loved ones around you. So whether you're the patient or caregiver, if you need to take a beat in a moment and shut the door to the world, that's okay. No one's going to judge you for doing that, and they'll respect you for doing it. And know that you can say no, and know that you can say, I don't want to visit today. I really don't want to take the phone calls today. I'm not going to text you back today. I just need a day, 2 days to be with my family or just to be by myself, and that's okay. Any questions or does anyone have anything that they can add to this that has worked for them? Or anything that's come up in the chat? It's that's such a great point. There's been so many struggles and so many people put into situations where they're by themselves, and it's just not acceptable. And that's where you go back to what Gabby was saying, to really record those sessions so you can relive them, with your loved ones, so two people can hear the information, or to do FaceTime. But it really is a very sad state that many hospitals are in, where they're not allowing the caregiver to come in with the patient. Is there any other questions before I move on? No. Okay, so we've really touched on this, second opinions. It's acceptable to ask for a second opinion. If you have someone offended by that, you may want to question why they're offended. I've used this analogy before. My goodness, if we, took our car in and they gave us an outrageous quote, we'd have no concerns about taking that car to a different mechanic to figure out what the best quote is. And we do that for so many other things, when we're looking at homes or we're, buying a car or I know I did a spreadsheet for my daughter's universities that she was interested in, looking at where it was most cost effective. We do that all the time in our life. And it's really important that we do that for our health as well. So never be scared to seek out that second opinion. And I remember feeling a little awkward asking for the second opinion from our surgeon. And all I said is that at the time it was the Canadian Cancer Society that I was using in PanCan. And I said, both of these websites say I have to ask for a second opinion. So I put it back on the organizations so that I didn't feel like I was saying it. I could say somebody else told me to do this. And it's just a way to get out of something. I've told my kids that when they're at a party and that they say, I gotta, my mom's gonna, really be mad if I don't go home, throw somebody else under the bus. It doesn't matter. But if you're not feeling comfortable or there's a little ounce of you that thinks, I wonder if there's something else out there, you have that right to ask for a second opinion. If the one doctor doesn't give it, you can go to another doctor. You don't have a family doctor, those are walk-in clinic, unfortunately. You can ask a walk-in doctor to do that, and they'll probably be most open to that as well. And you can be assertive about it. The second opinion I did have a hard time getting. And I really confronted my father's general practitioner and said, like, this is your role. Your role is to advocate for my father. Clinical trials, once again, we spoke about it. We know through research, global research, so not just Canadian research, not just the US research. We have research from around the world. We have 100 advocacy organizations within our coalition, and they all say the same thing. Patients have better outcomes when they're participating in clinical trials, and they're strongly encouraged to consider them and to look at them at the time of diagnosis. There's a lot of resources out there to help you select that clinical trial and bring that information to your family physician. I was going to say one other thing, and I forgot it, but I see that Lori's hand is up. So Lori? No, what we, usually if it's a second opinion, they go outside of their team. So you have a neutral person looking at yours, a brand new person looking at your case. So no, but you do know that the majority of cancer centers now, they'll go to, they'll take that person's file to they have it's a higher level of the rounds basically. So they will take their files to a roundtable discussion that involves a lot of the clinicians and really discuss those patients. So you do have a lot of physicians looking at it, but when we seek second opinions, usually they're from outside of that partnership. So for instance, you may have 3 or 4 HPV surgeons working together, and they would suggest a second opinion outside of that work team that's there. Gabby? Yeah, absolutely. And if you have a surgeon that thinks you have clear margins and you can go in for the Whipple, go in as long as you have that experienced HPV surgeon. But as Gabby said, no one has the right to say you can't have one if that's your wish. Long as you and it's fine that you need to be comfortable. You need to be comfortable with what's being told to you. Is there anyone else that had questions? Anything in chat, Jess, or anyone else that wants to yell something out?
Susan just typed in the chat, when is the best time to ask for clinical trials?
Susan, I would, upon diagnosis, right from the start, and I'll tell you why is as soon as you start treatment, whatever treatment it is, for whatever cancer you're being treated for, pancreatic or not, every time you go through a different treatment process, you become ineligible for different clinical trials. So why they're saying to sign up for clinical trials or to look at clinical trials right away is if you can find a clinical trial with standard of care plus, it means that you have more clinical trials available for you. So if you go in for your biopsy, you have the tissue, and you haven't started treatment, and there's clinical trials available for you, then that's the time to get in. Every time you start a new clinical trial treatment, it reduces the amount of options that you have for clinical trials. Every time you start a treatment, sorry, it reduces the amount of clinical trials you can access. Jessica actually is one of the individuals that helps the pancreatic cancer patients in Canada look for clinical trials. Jess, is there any trends or anything that you think you can talk about in terms of clinical trials when you're looking?
Yeah, so I agree, like from Dr. Ocean's support for caregivers session, and we've heard Dr. Ravi Ramji Singh tell us, like, the earlier you can consider them, the better. And the more interventions you've taken or treatment types you've taken, it limits your eligibility for sure, because they want these trials to be in very controlled settings. So if you come in at a different starting point than somebody else, it makes them less able to like draw conclusions from the treatment that they're trying to evaluate. Another big consideration, and I know it's not particularly available to everybody, but if you can consider traveling, like the wider the area that you're able to consider, the better. There's a lot of really impactful trials out west in Ontario, as well as the States. So if that's an option for you, that opens up a lot of doors as well.
Yeah, and there's also a lot of, and I'll show the website at the end, or actually, Jessica, maybe you can type it in as well under the Pancreatic Cancer Coalition website. The Pancreatic Cancer Coalition website also offers funding for people, or offers the names of organizations that provides funding. So Craig's Cause Pancreatic Cancer Society provides $500 and $1,000 patient support grants that can go towards travel. But there's also other organizations that do that as well throughout the States. And also the clinical trials, there's a lot of clinical trials that provide the funding for you. It doesn't really matter what your cancer diagnosis is or what your diagnosis is if you can get into a clinical trial, if they feel that you're a candidate and they feel that finances are getting in your way of participating, then quite often they can provide funding as well, or they do that right up front. Any other questions? I saw a couple of other things pop up in chat. Yeah, so you can go through PanCan's Know Your Tumor. And is that Lori that asked the question?
Yes.
Yeah.
Sorry. Yes.
So, Lori, I think you went through that. You went through that program as well. And I think you said that you had your results back within 2 to 3 weeks. That is really the trend that a lot of where we're going is that, you know, we're having these plugs taken at the time of a biopsy or surgery, and those plugs are being sent off for genomic testing. So that's certainly a trend, and it's great that PanCan now recovers American and Canadian patients for the cost. That relieves about $7,600 for patients.
So that in my clinical trial discussion a second ago too, if you have that information while you're investigating clinical trials, that opens up your eligibility as well, because there's more and more studies being done on like drugs that are targeting particular like gene mutations. But if you don't know that you have that mutation, then you can't enter into that trial. So that's really valuable information to have as well.
Awesome. Anything else before I move on? No? Okay, so this is just a quick slide, but it just shows you we have a clinical trial finder. So instead of you looking through huge databases that can be very overwhelming at a time that's extremely stressful for you already, you can use our clinical trial finder. PanCan has a very similar clinical trial finder. In fact, they helped us, create our clinical trial finder. So they're a great support in the States. And then they also have a worldwide database for clinical trials as well. So those links we'll be sending you as well in another document so that you have the direct links to all of this information and to access the support you need. This is probably the one piece of advice I give everybody, and maybe Gabby can start jumping in as well here. But whether you're a caregiver or whether you're the patient, everybody is living in a very heightened state of anxiety and stress and depression, and that's normal. Pancreatic cancer patients, there's a lot of research supporting depression. Even before a diagnosis, there's a lot of research coming out that patients have experienced depression, anxiety, and mental health concerns prior to their diagnosis. And that's maybe associated to hormones in the pancreas. But one of the biggest things I can say to a patient or a caregiver is just to stay in the moment. And understand that anything that you're feeling is okay. The only time it becomes not okay, where you need to get that support, is when you can't move forward. So when you can't get out of bed, you can't do the daily routines, that's when you need additional support. Or you may feel that you're going through those daily routines already, but you need additional support. There's medications, there's psychologists, there's social workers, there's support group meetings. There's a lot of places where you can reach out and ask for that help. Once again, you can't, it's, I say you really shouldn't, you can, but you really shouldn't go through this by yourself. I remember, feeling very isolated, going through the diagnosis with my father as I was his caregiver. I remember my dad's feeling of isolation. He was so irritated by people carrying on just normal small talk conversations with him and not really addressing what was happening to him. And he said, I just want to talk to somebody that gets it. And he loved these people that he was irritated with, but it's a very unique, when you are diagnosed with cancer, it's a very unique, set of emotions that you're going through. But if you look too far ahead, even a week, a month, a year, it can get so overwhelming and almost be impossible to handle your emotions, to go through those emotions. Really, just when you're first diagnosed or when your loved one's first diagnosed, just stay within the moment. And as you adjust to the diagnosis, and as you get the information about the disease, and as you get a treatment plan in place, you'll start to feel more in control of your feelings. But that when you don't know what your treatment plan is, when you don't understand the disease, you don't know what stage it is, that's even more heightened than just living with the diagnosis itself. So, and it's a lot of work to train your brain to stay within that moment is a lot of work, within that day. But it's really the one strategy, I think, if you can train your mind to keep you consciously have to keep saying to yourself, just stay in this moment, stay in this hour, stay in this day, just stay in the moment. It will become almost a form of a habit where you're not looking too far ahead. Gabby, what can you offer there as well?
That was more extreme than I'd say.
Right.
I'd say on a bad day you need to do that, but I think it's okay to have some plans and some hope, and it depends on the individual. One of the things I'd really like to say that we haven't touched on is it's great that people are here, because my number one thing is I find it can be very unhelpful when people try and hide. They try and hide that they're not well, or they don't want to tell people. And you've got enough to hold. You're holding together enough stuff that I'd say as soon as you feel ready, as soon as you're not like stingingly angry from the diagnosis or in shock, I would start telling people close to you, because then whether they want to like give you space or whether they want to help you, take it. Okay, this is your time, you deserve it. If they want to help you, it's because they love you, they respect you, they want to be of support. Tell people so that you get that space and that support. And some people think, oh, I'm going to have pancreatic cancer. I'm going to die. That's it. Pippa Hawley actually made this it's called the bow tie model. I don't know if you can see, but it's basically showing the reality of now, which is that at all stages, even if someone says there is very little hope, at all stages, if anything comes along that can help you, and I only talk for Canada because I can talk for Canada, you will be given it. So even if, and I've been on the board of hospice and all different things, even if somebody is in a hospice bed and they are getting completely end of life treatment, if we find things that will help them, they will get them. So don't feel that even if you have a very bleak outlook from the doctor, that they're forgetting about you. They're not. And I'm married to a cancer researcher, and I know that, you know, so look after yourself, do what you can do, but at the same time, there is always hope. Whether it's coming from a trial or new procedure or whatever. So you won't be forgotten. You go along with what you need to do, but at all stages, you'll be looked after. The other thing that some people, there's your own shock, but then there's also the shock of when you tell people and when you tell your children or your parents or your partner. And there's quite a useful thing from a Canadian, Dr. Rob Buckman. And this is used actually by doctors in ER mainly, but they have something called SPIKE. And SPIKE stands for setting, making sure that you're with someone that somewhere quiet, you've got time, and it's a bit calm. And then perception, like if you're telling your children or your parent, just sort of checking out what do they know already. And then invitation, asking someone if they want to ask you something first, because sometimes a child saying, I think you're not well, are you not well? We found that can be better than just pouncing on them with something. And I hope this was done for you, by the way, when you received diagnosis. And then the K of SPIKE is the knowledge, telling someone, this is the information, this is what I know, and I'll always be honest with you. And then the next one is empathy or education, or what we're going to do now, because like, especially with kids, they might say, well, what does this mean? And people's reactions, just like your own reaction, can be very extreme. And they can vary from people not wanting to talk about it at all to people wanting to talk about it all the time. I asked a friend with a cancer to tell me in cartoon style. She was a film writer, and she actually came up with some funny ones. She said, there's the Grim Reaper, the person who only wants to talk about her possibly dying. There's the witchcraft person who wants to do homeopathy all the time. And by the way, if you do anything alternative or complementary, you need to please first onboard your doctor. The reason why we call one alternative and the other complementary is that complementary can often work with the medicine. Alternative, you need to check. It may mess up your medical procedure. So please ask and check with your doctor first. Anyway, the witchcraft one. Then there's the selfish one who just won't talk to you about how you are. There's the ostrich who just ignores it and says, oh yeah, like your dad experienced, the people who just want to, oh, isn't the weather good today? Oh, you're going to the tulip festival. You know, they don't want to touch it. Then there's the religious one who says, come on, let's get baptized, or let's have a bar mitzvah, or do whatever we're going to do. This like religious, which may or may not suit you. There's the hedonist who says, let's spend all your money and party. And then there's kind of the amazing. And the amazing is kind of what we're hoping for, the person who's going to be there for you, ups and downs. And I hope and believe that even if people have these extreme reactions at the beginning, and you might have been some of those people too, over time that will calm down, and we should all gravitate towards the amazing. It's just we're gonna go with it. We're gonna work out what we need. And the other thing is, at all times, you are you. And whether that's how you treat your diagnosis, what you feel like doing that day, what you feel like eating, whether you want to have a party for your friends, whether you want to do it your way, because you are going to live your life. We all are, until the very moment that we do die, whenever that is. And therefore, I really encourage you to have some time reflecting on what's important to you, whether you want to phone someone you haven't phoned for a long time, whether you want to do some writing or art or whatever makes sense to you. Try not to censor yourself, because I know from being alongside some of the real end of life cancer groups, that there is enormous honesty and humor and adventure still to be had. Absolutely.
I think you've touched on a lot of great points, Gabby. A couple of them, I have to smile at the hope. We work with a lot of researchers from really all over the world, and so many of them say they don't have the research to support it, or, something tangible that they can test, but they know that those people living with the hope, with goals, often have a better quality of life and outlive what was expected, or outlive what was expected. And when you're talking about, still enjoying all those pleasures of life, we met a lady in St. John, New Brunswick. Her name was Teresa, on her first bike tour. So we used to do bike tours around the maritime provinces. And she showed up and she stood up and she said, I have 6 months to live, and we're going to live it well. And we're going on this huge European cruise. So, she talked about the cruise. We met her husband. They were ecstatic about going on this cruise. And the next year, we showed up at the same hospital. It was information sessions we had at different hospitals. And there she was. Teresa was there a year later. And she said, oh my God, I'm still here. And guess what? We're going on another cruise. And her husband kind of rolled his eyes and he says, yes, we're going through the money. And she was so happy. And didn't we go back that third year, and there was Teresa. And she stood up, and her husband stood up, and he goes, before she says anything, we're broke. But, they just lived life so well. And like you talked about, with that humor. And some people never get there and other people can. But, enjoying, no one knows how long we have. It's daunting when you're told how long you have. I think, sometimes I think many of us, if we chose, we wouldn't want to know. But it's living life for you, and what's best for you is so important.
It doesn't have to be
no.
It doesn't have to be a big bike ride or a cruise. It can be something like eating dinner backwards, letting your kids have dessert first.
Absolutely.
It can be, watching your favorite movie, and you just, whatever it is,
whatever's best for you,
right, that feels right to you, so that you stay you the entire time.
Yeah, absolutely.
Contact the people that matter to you, so you have that.
Yeah, it could be as simple. For me, I know that a huge stress reliever is just taking my dogs for a walk, and just being in the moment by myself and just having that time and that fresh air to get out. But it's really, like you said, Gabby, it's what's best for you, and being okay with that. And another thing to touch on, and I think I can blow through some of these slides because we've kind of jumped ahead, but your friends want to help. And as I said before, if you let them help, it helps them too through this. So let them help. And I think we went through a lot of these, talking with others that have been affected, treatment for symptoms. Your mental health is often forgot about above, and everyone's focused on your physical health. You really need to ask your clinicians for support for your mental health as well. Deep breathing, focus on moments, communicate your needs. These are all things that Gabby was great and touched on. Don't discount hope. There's the hope again, and accept help whenever it's offered. So it's a win-win. So I won't spend too much time. Gabby?
I was going to say, for your caregiver as well, whoever they are, or your partner, or whoever's helping with you, make sure that you're looking after them too. So they're keeping up with their mental health appointments, or their doctor, or their dentist, so that whatever happens in the future, they're loved and looked after as well. And they have the energy. You've all got to keep the energy to be there for each other, to look after what's going to come next. So even if it's something like them, if they say, I don't want to, sometimes people will say, I don't want to be away. It's okay. I want to stay home. Well, maybe phone up one of their friends and say, you know what, can you come and talk to Sue on the doorstep? I'm gonna be having a bath, you talk to Sue on the doorstep, just so that they keep those connections. It's really important for everyone to feel connected.
Yeah, absolutely. Besides the treatments, these are all really things that we hope both caregivers and the patients, consider doing. And, whether it's, for me personally, I've always had a hard time with yoga and deep breathing because my mind's always going. But I know that when I do take that moment for myself and I do settle myself down, it can help. It's just training yourself to do that. Laura, you had your hand up. It's hard for pancreatic cancer patients, based on the numbers that are diagnosed every year. I think social media has given us a great resource to reach out to people. I think taking the time to investigate the different organizations that can offer support groups, that can offer connections. I know that people even have connected through this. And also, the hope, I've spoken at medical oncologist conferences. Hope's different for everybody. So even if you're not surgical, that Teresa that I talked about, or I think of other patients, their hope was that they could get to a wedding or to see the birth of a grandchild, or to celebrate, to go hiking somewhere, or to go back and visit their Florida homes. I have lists of hope that people had. So, many patients are living well with pancreatic cancer as well. And I think, we either think of it as surgical and survival or a death sentence. And I think, there's so many great new treatments out there now that patients are living better quality of life, and they're getting to do the things, cross off those bucket list things that they want to do for themselves. So I think that's also important, but it comes down to asking a lot of questions, and doing that research. Gabby?
Yeah, no, I think exactly that. I think for me, the hope isn't necessarily that you're going to be cancer free. The hope for me is to encourage people to live well what time we all have left. And so for some, it's, I help people with, if they want to have a celebration of life party, or if they want to contact someone maybe they're estranged from. 8% of people are estranged from someone very close to them. Or some people want to, set up just set up something at their old school. Work out what really matters to you, so that whatever time you have left, and with pancreatic cancer, it is really difficult because, the odds are not great. And so to actually live that time well, and for it to make sense. And some people have been able to say, that these months, some of these months have been the very best moments. And they're not at Disney on a cruise ship. They are here, maybe talking through emotional things with people that matter to you, and maybe reflecting on your life and thinking, whoa, I've actually done quite a lot and touched a lot of people's hearts. And really feeling as though there's not stuff that's unfinished. There's stuff that there may be time that's not as long as we hoped, but I've lived it well. I've touched people, and they've been able to feedback, and I know I'll carry on in the people around me.
Yeah, Jessica pointed out that a hope for her dad was to get to race his race car again in the spring, which he did. And Judy was talking about, which we also have their locator on our website, the Canadian Cancer Society have a locator that you can fill out. So if you want to meet other people, we can certainly put patients in contact with other patients, and caregivers in touch with other caregivers as well. So, reaching out to those advocacy organizations can help you connect too. Please just put up your hand or shout out if I'm missing you. I think Jessica we have on the phone now, but if I miss you, just unmute yourself and yell out. I won't go through each of these points because, as I said, I'm going to pass this slide on, but changing relationships happen, and they're so hard. I remember, being a daughter where dad always looked after me, and all of a sudden I was looking after him, and we were talking about his swollen testicles. So I was like, this has changed so much. And it was hard to, talk about my swollen testicles, but we did it. And it was hard for me to come to terms that, that I was now looking after him, not because I didn't want to look after him. It was just our relationship took on a different role. I know that, spouses, take on, I remember Barb Fry, she's a nurse that speaks nationally. And she often talks about her and Peter's diagnosis. I say together, Peter was diagnosed with pancreatic cancer, and how her role went from being a romantic love relationship to becoming a caregiver, and how hard that was. And he's here 10 years later, but it's been a journey in itself, trying to get back that loving relationship, as a couple, and no longer as a loving relationship as a caregiver to a patient. So that in itself is a journey. We have patients that will talk about how exasperated they are with their loved one because they've made a meal that their loved one usually loves to try to get them to eat, and they won't eat. And that can be cachexia. That can be their body shutting down and saying, they lose their appetites. They no longer have, their body no longer, gives them the alert that they're hungry. And that's why a lot of pancreatic cancer patients, along with their pancreas not working, lose so much weight. So there's those frustrations over little things that you've never thought about before. Saying I love you a lot, trying to respect your patients, your loved one's decisions, or trying to respect your caregiver's decisions, or your caregiver's opinions, or your patient's opinions. Ultimately, the treatment plans will come down to your loved one, to the person diagnosed with pancreatic cancer. And I've seen a lot of discussions where caregivers are trying to force the patients to do a lot, but there comes a time where, you have to look at that, respecting decisions, respecting opinions, trying to get in a little bit of humor. I remember my best friend, she was like my sister. I'm an only child, so Shelley was my sister. And we went to, I think it was Burger King. She had a brain tumor, and she didn't have much time left. And she decided, after not eating a lot, she wanted to go and have a jalapeno burger. I think it's Burger King. And so we drove in, and it was a lot of work to get her in the car, and to get there, we did the drive-in. She took a bite in the burger, and she's like, well, that's just horrible. And, and we laughed. It was just a lot of work to get her to that burger, and it wasn't as good as she liked. So it's finding those funny moments in a really difficult situation, respecting people's what they need. Like Gabby talked about, you have to do what's best for you. And in that relationship, whether it's spouses or parent and children or friendships, you have to respect, the person with the diagnosis. You have to respect their decisions, and that can be hard. There's certainly a lot of decisions I always think I would have done that differently, but it comes down to that person and what they want and what they need.
And also forgive yourself when things go wrong. Things will go wrong in normal life, and just exactly that, to have humor with it and to try things, and it can sting, the things going wrong and the regret. So we just try to live this with as little regret as possible, as much kindness for ourselves and others, those close to us.
Actually, I remember Lori had said something, and it always has sat with me, and I've used it since, an analogy about, when we have a job or we have experienced different life experiences, we have a toolkit. We've developed a toolkit of what to do in different situations. But when you're put in a situation that you've never been in, you no longer have your toolbox is empty. So, knowing that you're going to do the best you can in the situation that you find yourself, is important to understand that everyone's going to do the best they can in the situation they find themselves, not really having a lot of tools, and slowly getting those tools as you move through the journey. But in those moments, you can only use the tools that you have. And then, and then develop the additional tools as you go. And some you may never get. Some of those tools you're not going to get. So it's understanding that it comes over time, and understanding that everyone does the best they can.
Yeah, and it's also fine. We used to think that doctors would say, "Oh, don't remind her of that." Don't remind the patient who has no legs that they had legs. Actually, in the last 10 years, there's been huge amounts of research on nostalgia, and this looking back on funny times is actually very lovely. Even if you're stuck in bed, you can still get out some photos with each other and talk about some lovely times you had, and talk about places you went, and talk about when things went right or wrong. And you can be the person with the cancer, or you the other person, whoever. You can just share memories and really what the best bits of your lives have been so far.
Absolutely. Before I move on, is there anyone that has any other things that they can add, or strategies that they know now, tools that they now would use going forward, or that they can share with anyone? And there's also a lot of great websites like Caring Bridge, where you can, or Facebook groups now, where you can create a group and let the people in that want those updates, and just do it once. Instead of answering all those different endless emails as well. It's hard. Changes in lifestyle, we've talked a lot about it. Everyone knows that you have a cancer diagnosis, your day-to-day life changes. How often do you need treatment? How do you get there? The distances to travel. The average Canadian has to travel 150 kilometers to there and back to the cancer centers. How does your role in the family change? And you look at gas prices. So you look at the roles roles in families change, especially if it's the, quote, breadwinner that becomes ill, financial costs of treatment. So you really, at this point as well, you hope, you ask a lot of questions, research, or ask somebody to research for you. There are organizations that can help with financial costs. There's assistance programs. There's a lot of, if you're paying out of pocket for medications, there's drug navigators that can help patients access drugs. A lot of the manufacturers of the drugs, the pharmaceutical companies, offer, I just lost the word, compassionate access to drugs. So for instance, in the States, there was somebody in Texas that told us that they actually have their pancreatic enzymes paid for 6 months, and then they pay for 6 months of the drugs. So, and those compassionate access to drugs forms can be found on the websites of those manufacturers. But once again, it goes back to Gabby. When people are asking how to help, say, I need a drive, can you get let's set up a schedule to drive me to my treatment. Let's, get a schedule to help me with the home, the grocery shopping, the vacuuming, the cleaning of the bathrooms.
Yeah. One thing we did is, I don't know if anyone has those, you can buy like dollar store clocks, when you move the hands to teach a child how to tell the time. And one of the things I recommend is when someone comes to your door, move the handles that morning to, I'm feeling sad, or I'm feeling weepy, or I feel like watching a movie, or can you pick up milk for me? Or nice. Can somebody put out the recycling?
Yeah.
Even if you can't say it in some other way. And people will be happy. When I go and see my friends who are not well, I want to see them, but I also want to be of help. And I don't want to be of superficial help. I actually want to know, do you want me to do your grass, pick up, walk your dog? What will be helpful?
People want to help. And it's hard to lose that independence. I see my mom losing a lot of independence. She's 84 and getting really cranky. And she's losing independence. She's losing her eyesight. So she knows that soon she's going to be very dependent on us. She feels like she's a burden, and she's not.
But it's kind of the payback for all the love you've given out. I say to people, actually, they're not doing this to everyone. People are doing it for you, or offering to this for you because they care.
And absolutely. And I think
this is our clock.
That's very nice. That's awesome. I think that patients often feel like a burden, and I want them to know that they're not burdens, that they're loved, and people want to help. And, once again, mom, I know, is feeling like a burden, and she's far from it. We don't mind driving her places. We want to be able to help we want to be there for her. Whether she's cranky or not, we want to be there. So, it's hard for patients to not feel like a burden, or to not feel like they're relying too much on people, but always remember that those people want to help because they care about you and want to be there for you.
And if we die when we die, actually people are glad that they did things. And I've got a whole list of things for children to do, because often people think, oh, don't bother the children. I don't want the children to see me like this. But often I've run quite a few years of, probably 2 decades worth of children's grief groups. And actually, they really like the idea that, I was in charge of bringing grandpa the post, or, I pinned up photos for him on the notice board, and it made them feel involved. And actually, people feeling involved is a very important thing at any age. So you are looking after them as well.
Yeah, and that is a great point, Gabby, that everybody needs to be on this journey with the patient, because it helps with their own grief process as well. And whether you're grieving a diagnosis, or grieving a loss of independence, or your loved one's off, independence, or you're grieving the loss of the roles in the relationship that existed before and no longer exist. There's so many different grieving processes that you'll go through. People want to be on that journey with you, and they need to be on it as well to understand the process that's you're going through.
And also, you can chuck away, I would say, throw off any movie versions of death and dying, okay? Because they don't really help. But if you can stay with what matters to you, like it might be that you contact your long lost sister and you want to have some connection. You just want to say, look, I just want you to know I'm going through this. I love you even if we don't get on, or whatever it is. It doesn't have to be this running together in the sunset and hugging, and it needs to be real to where your relationship is. So just get rid of movie versions of your life and live your life your way.
Absolutely. Before I go on, is there anyone else? And we've touched on this as well, and I won't go through all of each of the points, but when I talked about the grieving process and different components of your life that you'll grieve, it's also, you're going to grieve, if you're the patient, you'll grieve about, who you used to be, whether it's in your mood, your personality, your body. Your loved ones will grieve with you. There's a lot of tears shed with, my best friend Shelly and I, because, she changed. And that's okay. It's okay to have that grief about how you've changed or your body's changed, and it's okay to feel grief and sadness about your loved one who's changed, and understand that unfortunately a lot of those body changes and mind changes and personality changes quite often go with a cancer diagnosis, and it's accepting these changes the best you can, and once again trying to find the pleasures that Gabby's often spoken about, those small pleasures to help you through the grief of losing a bit of who you are, and finding it, in turning to that psychological help. There are a lot of great psychologists and social workers out there that can help you move through the process. It's not if you're going to see a doctor about your physical health, you can go see somebody about your mental health as well. It's just as important as your physical body. So looking after your mind and helping you move through these adjustments is really important. And for me, I personally think that if you have a physician, a medical oncologist, a surgeon, palliative care team, hospice care, your hospice and your palliative care team can certainly make those connections to a psychological, a psychologist or social workers, but it really should go hand in hand with your body. Your mind and your body should go hand in hand. So look after your body, accept the changes that are happening as best as you can, grieve them, it's okay. And there's really no right or wrong way to go through this journey. Everyone's going to do everyone's on this journey. Everyone's journey is different, and that's okay. There's no one way to do this, right? And there's no wrong way.
Are there any good resources for people who want to know about sort of being sexual and being with their partner? Is there any way you can link them to, or resources you can link them to?
We do have one in terms of I don't have one on I don't have one. I'm thinking of another resource, but we don't have one just for sexuality in a relationship. But I think that's something that maybe I have to look into, because we've never really explored that any further, Gabby. So maybe that's something I can look into, unless you have a resource that you can recommend.
No, that's why I'm asking.
Yeah, no.
I'm asking for everyone who might be thinking it as well.
Yeah, it's hard, so let me look into that and see what I can pull up, because that's certainly a change. And I know, whether it's a cancer diagnosis that affects those changes, or it's, menopause, that's a huge part of a relationship. And when that changes, it's hard on a lot of families. Is there anyone that wants to jump in? Make sure you yell out. This is a group you can yell out in. Where to find help. So these are about the changes in your body. So we certainly have our information on our website, but other organizations are the BC Cancer Centre, the Canadian Cancer Society, Livestrong Body Image. So that might be a place, Gabby, that I could look a little bit more, in the University Health Network. But I feel like a Livestrong Body Image might have something there that I'll look further into about sexuality. Facing a diagnosis, we often talked, all these little familiar faces I know, talked about how do you tell someone, how do you prepare them for the news, how do you go on this journey with your spouse, with your children, with your loved ones. Lori has already touched on it, and as has Gabby, being upfront, being honest, finding out what they know first, and finding out a way to communicate it so you don't have to say the same message over and over and over again. So as I said, Caring Bridge has a group that you can create your own group, and it gives updates to everybody that's in that group, a Facebook group. Gabby, do you know of any other networks that you can speak about where it informs everybody at once?
No, sometimes I say to people they should tell their nosiest person and let them enjoy telling everybody. Everyone's got a relative who wants to spread the news. And then the other thing is, use your gadgets, use your answer machine. And I certainly know as well that when people have been involved in kind of, celebration of life, end of life parties where they get everyone together and then they, say thank you, talk about their life, maybe everyone brings a photo and you have something like that. People tend to know after that to move away if it's really end of life, and then the really close people stay. So it depends on what stage and what people are doing. But there are lots of information places. I think there's also, is it the Compassion Train or something? I've written it in the book, but I can't remember. I'll look it up. There's one where you can actually say the different jobs you want, and people will fill in a timetable for you. So that's a really good one. And most of these are free.
Yeah. I have to laugh at this picture. This is Brian, and this is his daughter, Emily. And Emily is now a graduate of a university, and she actually was one of our summer students. So it's funny how these things work out. We had a lot of conversations when my father was sick and when my best friend was sick. My kids, of course, were very close to both. And we didn't hide it. I'm a big believer, and this is my own perspective, is that we all have a life cycle from birth to death. And we have to remember that for children, they come with their own experiences. So we come, I'm 50, and I come with 50 years of life experiences, where my children only came with 5 years of life experiences. So what was scary for me wasn't for them, because they didn't have all that knowledge. So it was never really scary for them. So when they were in the hospital visiting Dad, and I was thinking, how scary, and they shouldn't be a part of this. It was the ICU physician that was in charge of the ICU who said, bring them in, because they're only coming in with their 5 and 2-year-old experiences. So they won't know everything that you do. So let them lie in bed with, Papa, and let them be a part of his care. And that was probably some of the best advice I got, because they weren't scared. It was different for them, and we answered their questions as the questions came up, honestly, in children-friendly language. But we only answered the questions that came up as they asked them. But also, it was a way to have them grieve and go through the journey as well. So when they did lose their Papa, or they did lose Shelley, that they were a part of it, and they never felt left out or shocked when both persons passed in their lives. They had time to adjust to the journey. So I always feel like that's important, is to give everyone who's very close to those individuals diagnosed with any type of cancer or any type of disease, everyone should be involved as much as the patient feels comfortable, and never to feel that you have to save them from being in that journey with you. It helps them with their grief. The Water Bugs and Dragonflies is a book that I recommend to both patient or adults and children. It's a great book. It has brought a lot of comfort to our family and to many other families that have used it. This is, and here is Emily Full-Grown and her mom, so Brian's wife. Older children and teenagers need to and deserve to know a little bit more details. So this is as we go through, the ages, you tell them and you take them on the journey that they're comfortable with. Let them tell you what they're comfortable with, and answer the questions that they're asking as honestly as you can. Hiding something is not going to save them from losing somebody. And sometimes it can be quite shocking if they weren't a part of that process.
And many places will have groups for children or families of people going through cancer, and they're really good groups. I remember seeing a boy who he couldn't quite believe that there was a girl in the school whose parent was also living with dying. And he was like, really? What grade? Oh yeah, how do you know? What operation? And he was like, and he was kind of chuffed there was someone like him. He felt less alone. And you can also count on children on saying all the things that everyone else is thinking but not saying. And that can be hard, but it can also be funny and kind of a release. And some of the hard things, children will say really difficult things, like I remember one was, if when you die, will you still be my mummy? And it's like, oh, that hurts, but it's actually quite helpful because they're able to say what they need to say.
Yeah, and those are important discussions to have, and helps, those difficult questions children have can often help adults, think, about the questions and how to answer them, and really find peace with by answering some of those questions too. They'll never feel that, things were left unsaid. And
talking about death and dying doesn't make you death or die any quicker.
No, not at all. It's hard when you have a diagnosis hanging over your head, where, I think of one of my son's coaches was here yesterday, and today he's gone. And he didn't have a diagnosis hanging over. So it's once again, it's, whether you have a diagnosis or not, is having some of those important discussions and having that important time with your loved ones, not putting anything off.
The other thing, I don't know if this is appropriate, is, do people know about the Red Cross loan scheme? Is that something that if people are in their home, that the Red Cross will basically, don't be prey to some private company that's going to rent you out loads of expensive equipment. Normally, Red Cross loan scheme, you literally ring them up and they will find out and work with your doctor, find out what you need if you're going to be at home as opposed to in the hospice or hospital, and if you're going to be at home during difficult treatment, they will loan you it. I would recommend putting masking tape on it, and then you can give it back to them after. But if the occupational therapist tells you you should have something, take it. You can always like put it in the garage and put a blanket over it, but take it, because let's say you want it later and it's useful, you know, it's there and it's free.
Actually, you just said something, you know, that was at the very first of this, about clinical trials and about treatment options. Patients sometimes think when they go into a clinical trial or they start treatment that they're not allowed to stop it. It doesn't matter what treatment you take, whether it's, just standard of care or whether it's a clinical trial, you can stop it at any time and no one will be upset with you for stopping it. So, we always tell patients, if they're interested and they want to try it, you can stop at any time. So, Gabby just made me think of that. I had forgotten to mention that. Keeping informed, so facing the diagnosis, keeping informed. We've gone through a lot of this, so I won't continue. There's our Ask a Doctor program. If you have questions for a medical team, we can get those answered. We have on our medical team, we have surgeons and oncologists and geneticists and nutritionists and pharmacists. Someone asked in a question when they registered about the pharmacy role. Every hospital has oncology pharmacists. So don't hesitate to go into the hospital pharmacy to talk to oncologists and oncology pharmacists. Quite often they have support teams as well that will call in on patients if you want that regular contact. They're, the experts in medications and how they work and how they work against each other. So it's a great resource along with your local pharmacist, but oncology pharmacists, this is what they do. They treat patients with cancer. So they're a great resource. So ask your medical oncologist about the oncology pharmacist within the hospital and start a relationship with that oncologist, the pharmacy oncologist. We've talked about all this, bringing notes, keeping records of your medical assessments. And speak up. If you don't understand something, say, I do not understand this. And don't be scared. You have the right to say, I don't understand what you're saying.
And the other thing, can you speak to the fact that if someone gives you a palliative diagnosis, sometimes they can be doing it because it means you can get
absolutely
prescription and lots of freebies and
yeah.
By the way, the people I was thinking of are called lotsofhelpinghands.com. It was a computerized system for coordinating your volunteers to help. I don't know if it's still going or if someone's taken its place, but I will put it in the chat. But if you can speak to that, because I think that frightens people. They think, oh my God, I'm palliative. They haven't told me I'm dying. What it often is,
palliative care has a very low referral rate. It should have an extremely high referral rate. Palliative care, people can go in and out of palliative care for years. It does not mean that you're going to die tomorrow. But like Gabby suggested, palliative care rocks because they're bringing together a team who they can bring in social workers, psychologists. They support it's symptom management. Palliative care has a negative connotation, and now that they're starting to call it supportive care. So think of palliative care as supportive care. They are a team that works not only with the patient, but with also the family or the loved ones associated, that are very closely linked to that patient. So it's a team of people that are there to look after symptoms, to treat, your mind, your soul, your body. They come with so many, and as Gabby pointed out too, they'll come. They can either come out or you'll go visit them. And, they can certainly get equipment that you need to support you at home as well. So it's not, it's not that you are you're going to face immediate, imminent death within a couple of days. But it's a team that can be with you for months, for years. But they really are a wonderful resource. And they're also easier to get a hold of than your medical oncologist or your HPB surgeon. So, they have nurses specifically assigned to look after those individuals. So it's a great point, Gabby. Oh, so we had, for one of our pillars, I said we talk about the healthcare education. So we hold a national pancreas conference every year. Used to be Eastern, and now we moved into a national. And we had Sandy, and Lori's nodding her head that knows her. And Sandy spoke at our national pancreas conference to our medical community across Canada that attended. And the link, we'll send you the link as well. But she's a patient. She's been often given a low, a few months left to live, or she's late stage diagnosis, and she is living life well. She's living life to the fullest. She has a beautiful smile. She's full of a sense of humor. She's a goer. She's a great advocate for herself. She is an amazing individual. So I suggest that all patients and caregivers listen to this recording of Sandy when they get a chance, or watch it.
She's a rock star.
She's a rock star. She really is. And she's supported a lot of patients on their journey. So, somebody that's, an incredible individual and a great resource. And that is the end of the presentation.